Hi, this is John O with Affinity. Thank you for visiting us on YouTube. This educational video is about the impact of healthcare reform on provider reimbursements. Let's begin by talking about the two main goals of healthcare reform. First, the law requires most Americans to have health insurance coverage. Over the next 10 years, about 32 million uninsured people are expected to obtain coverage. In our state, New York, there are almost 3 million people, 16% of the population, who do not have health insurance today. Healthcare reform will dramatically improve the situation. The second goal of healthcare reform is to reduce the costs and improve the quality of care. Arguably, this is a more difficult task. You'll find that this aspect to the law gets very little attention by the press relative to the insurance mandate. The primary focus is on Medicare. That's because the federal government has control over this program. However, what happens with Medicare could have implications or spillover effect onto the commercial marketplace. This second goal is what we'll be talking about in this video. Much of the information you'll find on this topic, including on the internet, is dense and hard to understand, but we'll try and cover it as simply as possible by focusing on a few key points. How will healthcare reform reduce costs? First, there's going to be smaller increases in Medicare payments to hospitals and other facilities. Interestingly, primary care physicians get a small bump up in payment levels over the next 3 years. This gesture probably recognizes the fact that the economics for primary care doctors who accept Medicare are terrible. Second, there will be reductions in payments to Medicare Advantage plans. Right now, Medicare Advantage costs the government more than traditional fee-for-service. The idea is to get these two programs to cost about the same. As a result, physicians who have a lot of Medicare Advantage business could be negatively impacted over time as commercial health insurers lower reimbursement rates. In our opinion, the long-term prospect for the Medicare Advantage program is not very good. Third, the government has sanctioned a number of pilot programs to achieve cost reduction and quality improvement. There's probably a good chance that some of these pilot programs will be widely implemented across all of Medicare and then later on adopted by commercial health insurers. So let's talk about one of the key pilot programs that launched this year, bundled payments. Well, the concept of bundled payments is not new. However, what's different with the new bundle payment model is that it covers the services of multiple providers across a broadly defined episode of care. Now that's a mouthful, but basically the way it works is a contracting organization, most likely a hospital, receives the bundle payment from the government and then it distributes separate payments across all the providers involved in the care. As we understand it, episode of care begins 3 days prior to hospitalization and goes all the way to 30 days following discharge. The bundle payment covers inpatient and also outpatient, physician services, and post-acute care. If a hospital, the contracting organization, can deliver all of these services at a lower cost than current Medicare levels, the government will share some of the savings. And if quality standards are good, there are also bonus payments. So what's the likely impact? Well, it's too early to tell, especially how physicians are going to fare from all of this. However, one possibility is that hospitals will continue consolidating physician communities. You see, economies of scale are very important under this payment model. Therefore, we may see more and more doctors becoming hospital employees. This topic has lots of tentacles, it's controversial, and there's much more to discuss, but hopefully we've now covered some of the fundamentals. In conclusion, we've got some parting thoughts. For most physicians, healthcare reform does not have an immediate major impact on reimbursements. However, the law sets into motion small steps to test ideas on how to contain costs and improve quality. This process or journey will take some time, but there may be significant impact on provider reimbursements at some point in the future. Thank you for your attention, and please consider leaving a comment. We appreciate the feedback.